All right, so the os coxae, these are sometimes bones that people struggle with because they're hard to orient. If you have them physically in your hands and you can move them around and look at them, or if you have an articulated skeleton, you can appreciate the orientation a little bit better. But when you're looking at pictures of these, that's where people usually get confused. So most osteology you can learn from pictures, but I would definitely recommend getting in lab and actually holding one of the bones or bone models, or even just looking at a skeleton. That will really help you with the orientation of these. All right, so this is two os coxae bones, and these would articulate kind of like this to sit in the pelvis. So what I want you to appreciate is that there is a kind of bowl shape to this. So the way that I'm going to talk about this is more like internal versus external. So pretend this is still attached. I only got two hands. But if this is still here, you have an internal surface of the bowl and an external surface out here. So this is like the pelvic, the inside of the pelvic area. This would be outside of the pelvic area. So this would be attaching to the lower extremity, and back here, this would be the gluteal region. So if you sit them like this, so these would be articulated. Now all of this whole surface is going to be the medial surface, and in a lot of pictures they will just sit it like this and call this the medial surface. But it's really more like internal, because this part kind of wraps around and becomes anterior. So think of them as more like internal and external surfaces of the bone as opposed to medial and lateral. So internal view would be like this, and then external view would be here. So the os coxa is actually three bones. So during development, it forms from three separate bones. So here, up here, you have the ilium. There's some really nice color-coded pictures where it shows you the actual parts of them, but this would all be ilium, including this part here. Then this part back here, this would be ischium. So you have part of this and then all of this. And then this kind of like V-shaped bridge of bone here, this is the pubis. So you have ilium, ischium, pubis. Okay, now on each different bone, there's going to be a lot of different structures. So let's start with the ilium. So again, the ilium is all of this up here. Now on the ilium, the first thing you should notice is this crest up here. So this is the iliac crest. This is a really important landmark because it's an attachment point for a lot of different muscles. It also is very important clinically for bone marrow harvesting. So bone marrow biopsies can be done here. You can also harvest bone marrows to donate for transplants. You can also take some bone marrow here to use as a bone graft. So this area is pretty clinically significant. The reason for this is it has a lot of nice red bone marrow. So iliac crest, and then that's just like the top border of the ilium, and it's going to connect two bumps. So you have a bump here and a bump back here. Now these bumps, if we picture this in the body, so if I'm holding this on myself, so this would be my right pelvis, so this bump would be your ASIS. So let me flip it back. So ASIS, that stands for anterior superior iliac spine. Then this one back here, this would be your PSIS. So this is your posterior superior iliac spine. So the ASIS is usually palpable, and so it's a good reference structure when you're examining a patient. It can be useful for finding various structures, including Mcburney's point. So Mcburney's point, if you haven't learned about that, that's basically where the appendix is usually located, and it's about a third of the way from this, the ASIS, to the umbilicus, which is your belly button. So if you palpate this on your patient and then find their belly button, about a third of the way through is typically where the appendix is. It's also an important area because it's the attachment of the inguinal ligament, which is kind of the transition from pelvis and abdomen into the lower extremity, and it's also the attachment of the sartorius muscle, which is one of the anterior thigh muscles. So ASIS. And then PSIS back here, this is another bump. It's kind of like the end of the iliac crest back at the posterior part. It's also one of the attachment points of the posterior sacroiliac ligament. And then notice you have two more bumps. So this was anterior superior iliac spine. This here is now anterior inferior iliac spine. So this would be ASIS, AIIS. So the AIIS is an attachment for the iliofemoral ligament of the hip joint. So that helps hold the femur head in place in here. And then this bump back here, so this would be your PIIS, so your posterior inferior iliac spine. So remember, this was posterior superior iliac spine here. Now this is posterior inferior iliac spine. And this can be a good reference structure on a patient during external exam, because the little like back dimples that some people have, that's what this is. So that's that area. Also on the ilium, so here you have this whole surface. So this whole surface is kind of the wing or the gluteal surface. So if we sit this, again, if this is on me, so this would be my right os coxa, this is again internal. So what we're looking at is back here. So this is the external. So if I hold my hand here and kind of flip it back down to keep you oriented. So this whole surface is the gluteal surface. And then on here, you have 3 different gluteal lines. So honestly, on this model, they're not very prominent, but you would have a posterior gluteal line, a superior gluteal line, and then, or no, sorry, a posterior gluteal line, an anterior gluteal line, and then an inferior gluteal line here. So posterior, anterior, inferior right here. And those are usually not that prominent on the bones, but it is an important attachment point for the 3 different gluteal muscles. So important to know. So all of this is gluteal surface, and then you have your 3 gluteal lines. Moving inferiorly, so you have this big notch here. This is called the greater sciatic notch. So this is a notch on the ilium, and it's pretty big. So this is your greater sciatic notch. And in the body, you actually have a ligament here. It's your greater sciatic notch, but then if you have a ligament in the body, so if this was like in a patient, they would have a ligament called the Sacrospinous Ligament, and that actually turns this notch into a foramen. And this is important because there's going to be a lot of structures that we're going to talk about when we do pelvis that exit the pelvic area to get into the gluteal area or other areas. So greater sciatic notch actually turns into a foramen in the body, important area for transmission of various structures that we'll talk about. Then, because you have a greater, you can assume you're probably going to have a lesser. So this down here is your lesser sciatic notch, and this, now we're kind of on the ischium here. So we're not on the ilium anymore, we're on the ischium. So this would be your lesser sciatic notch. And this one also, because it's a notch here, in the body, you're going to have 2 ligaments that actually turn this into a foramen. So you have the sacrotuberous ligament and the sacrospinous ligaments that actually attach on here and make this an actual hole. And again, you're going to have different structures passing through there that we'll talk about when we get into pelvis. So splitting these 2 notches, so you have the greater sciatic notch and the lesser sciatic notch, you have this big bump here. This is your ischial spine. And the ischial spine is important because you can actually palpate it in a patient. So it's an important landmark. It's also a good reference structure and landmark when you're doing a pudendal nerve block. So keep that in mind, and that will make sense once we talk about the pudendal nerve and how it travels. But the ischial spine is also an important area of muscle attachment, and it's where the sacrospinous ligament attaches to. So you have 2 notches, greater and lesser sciatic notches, kind of split by this pointy part, which is your ischial spine. So don't confuse the ischial spine with this, which is your ischial tuberosity. So the ischial tuberosity, so this is your ischium here, the ischium bone. So where my fingers are. Now on there you have the ischial spine and the ischial tuberosity. The ischial tuberosity is just this kind of big roughened area, so pretty much all of this. And this is basically where you're sitting. So when you sit on your bones, this is your kind of like your sit bone. That's where you're actually sitting down on and putting pressure on. It's also an important landmark because it marks the lateral boundary of the pelvic outlet, and it's an attachment point for a few different muscles. So part of your adductor magnus, and also the 3 hamstring muscles in the posterior thigh. So this is a good landmark, definitely a structure you should know. So don't confuse ischial tuberosity and ischial spine. What else? So continuing with this view, on here, you see this big kind of depression. This whole thing in here is the acetabulum, which is where the head of the femur is going to sit. So the head of the femur articulates here, and where it's nice and smooth in here, this is your lunate surface. the smooth part, and then the whole indentation, that entire hole, is going to be your acetabulum. And the acetabulum is actually where these three bones join together. So if you look at a color-coded picture, about a third of it, this third would be from the ilium, about this third here would be from your ischium, and this third here is from your pubis. So that's where all three bones kind of come together and fuse. So now moving a little bit more this way, so if we're still on the external surface, right? So if we move more anteriorly to the pubis bone, you have a couple different structures. So again, the acetabulum and the lunate surface. Here, you're gonna have two bars of bone, and usually a bar of bone is called a ramus. So plural is rami, ramus is singular. So this is your pubis, and then you're gonna have two bars of bone that kind of connect it to the two other bones. So this one up here, this would be your superior pubic ramus. So just the bar of bone connecting these. And then this down here would be your inferior pubic ramus. So the bar of bone connecting the pubis and the ischium. So if you put them in anatomic position, it would sit like this. So this would be superior pubic ramus, inferior pubic ramus here. And then right where they come together out here, you have the pubic symphysis. So this is the symphysial surface. So right there. This is the symphysial surface of the pubis, and that's where the two pubic bones articulate. So it would sit like this. And the reason it's called a pubic symphysis is because this is a symphysial joint. So there'd be a little bit of cartilage in between. It would sit like this. Where all of these kind of come together, it forms this big hole. So this hole is called your obturator foramen, and in the body, pretty much like this much of it, like that much of it, is going to be covered by a membrane, the obturator membrane. So all that's actually still a hole or a foramen in the body is what's open right there, so not covered by my fingers. So that part that's not covered in the body is called your obturator canal, and that's how the obturator vessels and the obturator nerve can get from inside the pelvis through here to get to the medial compartment of the thigh. So that's your obturator foramen in the body. It would be covered like this with the obturator membrane, leaving that to be the obturator canal. Also up here on the superior pubic ramus, you have this kind of pointy part of it. So see how this ramus down here is like nice and smooth, but then on this one up here on the superior pubic ramus, you have this crest. So this crest on the external view is your obturator crest, and one of your obturator muscles is going to attach there. So obturator crest, obturator foramen, obturator canal. All right, I think that's it on the external or the lateral view. So let's turn and go to the internal view now. So on the internal view, again, you still have ilium, ischium, and pubis. So let's start with the ilium again. You can still see the iliac crest. You can still see the PSIS, PIIS, ASIS, AIIS. And now this internal surface, it's nice, it's smooth, it's scooped out. This whole area here is called the iliac fossa, and that's where the iliacus muscle sits in the body. Then back here, you have this big roughened area. So this is the iliac tuberosity. This is not that significant for anatomy purposes. Anthropologists can use it to determine like age and sex and things, but that's what this roughened area is. And then notice, like on that, you have this kind of more smooth part of it. So this kind of ear-shaped smooth area, this is the auricular surface of the ilium, which is kind of next to this iliac tuberosity. And it's smooth because this is where the sacrum articulates. So in the body, you would have these two bones together, you'd have these two together like this, and then back here, the sacrum would sit in the middle and articulate at both auricular surfaces. All right, moving inferiorly, so now you have this ridge here. So this is your iliopectineal line. So this is made up of a few different things. It's made up of this line on the ilium, which is your arcuate line, and then this line here on the pubis, this is your pectineal line. So together, the arcuate line and the pectineal line form the iliopectineal line. And this is important because it's going to be part of the pelvic brim. So that is an important structure to know. You can still see your greater sciatic foramen, your ischial spine, your lesser sciatic foramen. Here you have the pubic crest, and then your pubic symphysis or your symphyseal surface again. And I think that's it from the internal view. So if you have these articulated, you have the pelvic brim. I grabbed a sacrum so you can actually kind of see. So this isn't going to be perfect because I'm trying to hold this all together with one hand, but essentially your pelvis would sit like this. So you would have sacrum in the back at those auricular surfaces, you'd have ilium on both sides, and then at the front where my hand is, you would have the pubis articulating at the pubic symphysis. So the pelvic inlet or the pelvic brim, that's going to be made up of this here, which is your sacral promontory, and then kind of along here, along the wing of the sacrum or the ala. So if this was perfect, then it would be like here, here. Then you go along the iliopectineal line, which remember is made up of your arcuate line on the ilium, the pectineal line on the pubis, and then your pubic crest. So all of those make up the pelvic inlet or the pelvic brim. So if I just hold one, maybe this will be better. Okay, if I kind of hold it like this, you can see the inlet better. So the inlet, again, this is made up of here, your sacral promontory, the wing of the sacrum here, and then your iliopectineal line. So remember, the iliopectineal line is made up of your arcuate line here and your pectineal line here. So together, those make up your iliopectineal line. Then over here, you have this kind of roughened area on the anterior pubis. So this would be your pubic crest, and then that would then connect to the other side. So all of that is your pelvic inlet or your pelvic brim. Now, I just realized I forgot another structure. So this little bump on the anterior pubis here, that's actually your pubic tubercle. So that's also an important structure. I think that's it for structures. Now for siding, how do you know if this is right or left? So if this is sitting on the table, again, like I told you, the pictures are gonna have this perfect view like this. But when you just sit this down on the table, it doesn't sit like that. So is this internal or external? So this, the first thing to notice is this big roughened area. So this would be your iliac tuberosity with the auricular surface. You know that that has to articulate with the sacrum, so that has to be facing internally or medially. Now if I flip it over, on a lateral view or an external view, the gluteal surface is all smooth. There is no roughened area. So that's the first thing I always tell people to look for. So if you see just a smooth surface, you know that this has to be the external view or the lateral view. This is your gluteal surface. And then after that, you see this. So this is your acetabulum, and you know the head of the femur has to sit there. So this has to be facing laterally. And then you see this roughened area. This is that iliac tuberosity, or not iliac, ischial tuberosity, excuse me. And this is where you sit. So you know that that has to be kind of posterior and inferior. So if you kind of rotate that around in your head, you know that this is a right. If it's sitting medially, again, you see that roughened surface. You say, okay, well, this has to be internal and posterior because the sacrum sits here. And you can also see the pelvic brim. And then you know that the pubic symphysis is medial. So then you can kind of picture this as a right. Now there is a trick if you're having trouble with that. You can hold it kind of like a phone, like this, think like old school phones, and put this part, so put this up towards your ear and put your mouth here. So I know you can't really see me, but I'm holding it up to my ear and it fits nicely. So you're gonna speak into the obturator foramen. So you can say, hello, obturator. Haha, get it? Like operator. So if you try to do that with your left, what's going to happen is this is going to be where you're speaking into. This is going to kind of hit you in the face because it's not curved right. So if you try to hold this up to you, it doesn't really work. So obviously you can't do that during a test, but if you're having a problem orienting it, that's like a nice little trick. So it's only going to fit on the side that it is. So if I'm holding two phones and I put them up to speak into them, it should fit nicely on the side that they are from. And then they would sit in the body kind of like this here. So the other thing to note is that the pelvis does have a tilt to it. So let's look at the articulated skeleton and I can show you the tilt. the way that I tell people to learn this and kind of picture it in their head or articulate them when they're holding them is look for your ASIS. Your ASIS here should be in the same vertical plane here as this, which is your pubic tubercle. So ASIS and pubic tubercle are in the same vertical plane. So notice what has happened to the pelvis. So it's tilted posteriorly. So oftentimes when you're studying these, you hold them up perfectly straight with this in the front, but you have to keep in mind that you have the sacrum kind of tilting back here, and so this would be more tilted. So again, just look at it from the side and you see that the ASIS here and the pubic tubercle here are in the same vertical, are in the same vertical plane.